keeping in mind that the federal poverty line for a family of 4 is about $27,000 a year. So this, and like was mentioned, is very important. This is in center-based settings where there is a salary. Home-based settings, like was mentioned, oftentimes they are making far, far less, if making any sort of salary. The research is very clear that low wages equate to high turnover. From 2016 to 2017, the latest numbers we have, a quarter of the workforce left the field, and this is consistent over time. So who is this workforce? This workforce is 24,000 or so individuals, largely in centers, but also a great proportion are in home-based family child care. They tend to be mothers themselves, female mothers, more racial, ethnically diverse than Oregon adults, and 3/4 of center staff have some college or higher, and it's an increasingly educated workforce. Small home providers play a very crucial role. They're often who provide care to non-traditional work hour for families that need weekend care and those kind of things. And they're least likely to have a degree and more likely to speak a language other than English, which is really important for families who are looking for that language cultural match. So why is there this mismatch between the tuition and wages? We know that Oregon families fund 72% of all annual child care expenditures. This is a great difference compared to what is currently coming from public federal and state funds. And so child care facilities can only charge and set prices as to what families can afford. And like has been said already, about 80% of revenue goes to wages. And so they're not able to pay the workforce more. But we know that small public investment, smaller than the parent investment, is making a difference. So when we looked at our Child Care Desert report, we also looked at, of all the slots available, how many of those slots are publicly funded. So that's programs like Early Head Start, Preschool Promise, Oregon Pre-Kindergarten. And we found that public investment plays a major role across Oregon in the supply for the state. So the green shaded counties here indicating where there's at least 25% of counties that have, or 25% of their slots are publicly funded. If those were to be removed, there would be an even greater crisis. And so public funding plays a substantial role in what is available. So in summary, Oregon has an inadequate regulated child care supply. What is available is expensive, yet the workforce struggles to stay in the workforce and is largely poorly compensated. And public investments can improve access to care as well as the well-being of the workforce. Thank you.
Questions from members? Representative Drazen.
Thank you.